hand option if you can do it within Teams, but I'll also pause every now and then and see if folks have questions. I will hopefully be able to see both, but look to Marianne and Tracy also to flag things if I don't see it. Feel free to use the chat. And then lastly, you may have noticed that Mariana or Tracy started the recording, so we can record the session for people who can't attend today. They'll still be able to hear the information. Our hope is that you all are okay with us doing that. It's really for the purpose of other Project Aware folks. Okay, so I am going to share my screen. Maybe.
And Laurel, can I just say quickly that I'm realizing now that I still need to send out the recording and the slides from our from our previous office hours, which I will do today at the end of this one.
Okay. Yeah, I mean, bear with me while I get everything situated on my screen so I can see you as well as the slides. Just takes a minute. Okay, do you all see the slides? Great. Okay. Whoops. So my hope is that we'll talk through budgets, what's in your budgets, how to invoice, how do you do budget adjustments, what's allowable, what needs prior approval requests, if there's additional needs, what do we do with that? And then, like I said, some questions. Within all of this also, I have a couple slides that are specific to what SAMHSA, our federal funding entity, the Substance Abuse and Mental Health Services Administration, what their expectations are of us, that then get passed down to you. Some of this language is in the grant agreements with the school districts or with the designated agencies, but I think it's just helpful to really talk through this. This is not specific to any contracts for technical assistance or evaluation or any of that. This is really for the providing regions. So I thought I would grab a couple of slides from SAMHSA's welcome webinar that they did with all of the awardees, such as us. So passing on their message of welcome to this community of grantees and the important work that they're funding all of us to do. So I thought I would just extend that to you as well, because you are a key part of this. We couldn't do this without you. And then also to have you know what we're a part of. So these are the other awardees, so people who received the Project Aware grant in fiscal year 23. We're joining other cohorts of other years, so I don't have those listed, but this is our current cohort group, which is, you can see some of them are just specific school districts. I think there are some tribal entities and there are some states or counties. We're listed in here as the Agency of Human Services because that's how we are registered with SAMHSA when we do grant applications, but it's really held by Department of Mental Health and in partnership with our Agency of Education. But some cool partners across the country that we will be doing some webinars and peer-to-peer learning experiences with, and who we can pose questions to and ask, like, how are you dealing with such and such? But thought I would share that. Then they had this slide about the budget and the budget periods. Just to remind you that we are functioning on a federal fiscal year, which is typically very end of September or really October through September of each year. And that will affect how we budget your grant agreements and when we have to make sure that we have final invoicing in before we have to do our federal reporting, which I'll get to in a little bit. But those are, it gets into this kind of important cycle of when do we know about any carry forward from the prior year that we didn't spend and what can we use that for? So there are certain timelines that we'll have to follow, but this lists out each budget period, that's what the BP is, for each of the 5 years of this federal award. Okay. And then I stole some language that SAMHSA put into their notice of award to us, which is then directly relevant to all sub-recipients, such as the LEAs, the DAs, and other entities that we are funding with these funds. So anything that SAMHSA expects of us or some of the federal regulations that we have then apply to those that we are funding with these federal dollars. And so I just wanted to put these in here. I know the finance people, this will probably mean more to you than it will to the program people. And again, I think some of this is in your grant language, but just wanted to reiterate, I'm not going to read the slide, but it's here for your reference. I did want to note this, we have multiple special conditions, one of which I just wanted to make sure that program folks were aware of, that we can't actually use these funds for promotional items. So we can't buy pens or bags or anything like that to promote our work. So I just wanted to reiterate that. And then the reasonable cost expectation in here, that is something that we've already evaluated, if you will, in what we've put into your grant agreements. But as we go forward, if there are new costs that you have that we engage in dialogue around, is this something that could be spent either with reallocated funding or potentially with new dollars added if we have unspent funds from elsewhere? We'll just have to run it by this reasonable cost consideration. I should say our finance person unfortunately was away today, so she's Alex Van Offra. So if there are more specific detailed questions that we can't answer, we can always bump them to Alex and we can respond to folks through email with that. She's also a great resource as we go forward, but I'll probably be mentioning her as we get into some of these later slides. Okay, so for the LEA and DA grants, this is language that's taken almost word for word from your grant agreements, but there is a maximum dollar award. That is not like a guaranteed amount. It's just like, here's the cap of what can be spent within the, or invoiced within the line items that we talk about. And we will pay for services delivered or, expenditures that are reasonable within that. We're not just paying out a lump sum. So we're paying based on your expenditures and your costs. As with most federal awards, these funds cannot supplant, they can't replace funds that you're already using to buy something, but they can enhance what you might have in existence. So just want to make sure that the supplant rule is in effect with these. And then in our agreements with you, we say that you're allowed to do a 10% rebudgeting within your budget without seeking prior approval from DMH. It needs to be, again, with the reasonable costs and within the budget line items. If you're adding a fully new line item, that needs to be something that gets prior approval from DMH. And so if there's something that you need to do some adjustments, especially this first year, I think I say this later, we are all way underspent, which is pretty typical for a first year federal award because it just takes so long for our Vermont process to get through the joint fiscal approval to receive the federal dollars before we can then start to issue agreements out and then for people to hire, et cetera, et cetera. So there's always unspent dollars. And so we recognize that you likely might want to do some readjusting within your current budget. If it's over 10% of your budget, then that's where we want the discussion and request up to DMH. We'll say, well, actually, I think I have a slide on well, I'll get to it. I have a slide about how to do that a little bit later. So anything over 10%, we need prior approval from us before you make those adjustments. Okay, here is an example LEA budget. I am focusing mostly on LEAs, partly because I think it's new for you to have a financial agreement with Department of Mental Health, whereas the designated agencies have more experience in agreements with Department of Mental Health, but I can speak to both as needed. I'm just using the LEAs as the examples here. So this is an example budget where we have some line items that are clear. So we have personnel line items, we have supplies, and we have some amounts that are kind of like up to the 80,000 per personnel, which includes salary and benefits. We don't know the details of what those salaries and benefits actually are. And so we were asking each LEA to let us know once you actually do hire and fill your position, These are required positions under the federal agreement, so there has to be a full-time LEA coordinator in each LEA that we're partnering with. And so we just ask that you could tell us the name. We actually have to submit a key personnel prior approval request to SAMHSA. So we have to submit the name, the resume of that person, and then their salary and benefits and level of FTE. And then SAMHSA generally just approves that, but they need to know that we actually have people who are qualified in those roles and that their salaries are reasonable. For supplies, we have line items in here for a cell phone for that coordinator, as well as we just did a generic line of outreach and training materials. So if you need to print out things to be sharing with people within your school building or with families, or if you have other related expenses to do some of that informing of staff and families and community members about the different topics that you're working on, there is a budget line in here for you to do that. We didn't get too specific about what that item by item needed to be, but when you submit an invoice, you'll just need to say supplies and then a generic description of what that supply was for. Then lines 3 and 4 are kind of placeholders because we knew that each LEA was going to need to either purchase and install or expand use of a universal screening tool for social, emotional, mental health. And so this was a generic budget line item of 40,000 to support your efforts in that. So that could be the purchasing of the tool, the licensing access, the technology that you need to embed it within your system and connect it with other data or whatever it is, training of staff. We will need a more detailed breakdown of that 40,000 to submit to SAMHSA because when we got our notice of award, they gave us some conditions of that award, which included providing more detail for certain budget items. These are 2 of them. And I'll show that in a little bit, but our hope is that we might know that by Friday. We had SAMHSA initially told us they wanted that detail by the end of October. We said, there's no way we're going to have that. This is driven by the local needs assessment. How can we know until we go through that process? And even now, I anticipate we might be saying back to SAMHSA, we still don't have this budget detail. The LEAs are still in their process, and we don't want this to be cart before the horse. We actually want a best practice approach to identifying a screening tool and figuring out what you need to get that established and installed. We want you to have input from key stakeholders before you select a tool. And that's where the folks from UVM can be really helpful in how do we carry out those best practice approaches. At some point, we expect that you will need to spend money in this realm. I don't know if it's going to be the school year. Maybe there might be some pieces that maybe it can be over the summer and into the next school year. This might end up being something that we have to do a more formal carry forward of funds into the next federal fiscal year. We have this item in each year of the grant because we know that continued licensing purchases might be a part of it, training new people as you have turnover, unfortunately, of staff, whatever it is. But our request is if you have any specifics in this line item that those details be submitted to us as soon as you have them. If you have it by Friday, great. We have to submit a budget update to SAMHSA by the 15th of this month. So we're prepared to make the case for why we might not have it yet, but also to include detail if you do have the detail. Same thing with the line item 4, which is the social emotional learning, wellness, or mental health related programming. So this is where the LEAs can purchase additional programming, subcontracting with entities to come into your school, whatever it is to address student needs related to social, emotional, mental health, and wellness. So if there's some school-wide curricula that you want to purchase, or if there's someone that you want to bring in to do some training for staff to help them in their work with students in this arena, we really are leaving this open as part of, again, your local needs assessment and looking at what are your current resources, where are your gaps, and what, as a district community leadership team, are you starting to identify might be a good thing to be bringing into your schools or district to help address some of those needs that might be identified through your data and that gap assessment. So before you start spending this item, we need some of that budget detail provided to us also, because we then have to provide it to SAMHSA. But there's an $80,000 line item each year to support expanded activities in that array. Okay, I see a hand up. Mark, go for it.
Yeah, hi, can you hear me okay?
Yep.
Yeah. So I'm going to be making an offer this week for an MTSS coordinator.
Mm-hmm.
So we haven't had the compensation conversation yet, but you want to know by Friday what?
Only if you have it.
Wow. Huh?
Only if you have it. We
I'm gonna get this wrapped up this week. This is not the only
Great.
thing that I'm trying to resolve. So you want to know how much we're spending out of this $80,000 allocation?
So for the personnel, for your coordinator, that's line 1.
Yeah.
Yes. And so it would be helpful to know what we have to submit is the annual salary. So even if you're only spending, 10,000 for the remainder of the school year, we need to know what is that annualized for the whole year. So I have to submit to SAMHSA what's the annual salary, the FTE, and the person's name and resume.
Okay, so this person is not going to start until July 1st.
Yep.
So are we on state fiscal year reporting or federal fiscal year? And does that even mean anything at the federal level anymore, considering how they do or don't pass budgets, depending on how you want to look at it?
Yeah, no, I hear you. We, for this project, are functioning on the federal fiscal year.
Which is October 1st to September 30th.
September 29th. September 30th through the 29th. It's a very odd, it's not even October 1. I don't know why they give us that extra day of September, but yes.
So if I tell you that I've hired person X and this is the compensation amount that we're going to claim against the grant, you'll sort out from that. Do I have to try to figure out the federal?
Don't worry about putting it onto the federal schedule. Just, do you have an annual salary that you are proposing to this person? And that's what we can use. And we can say, this is the annual salary. Even if you're starting at July 1, it'll go through June, but the annual amount is still the total that's going to end up being spent.
How much detail? You said something a couple minutes ago about name Tracy just popped something up in the chat, so maybe that she's answering the question I was going to ask. Name FTE.
Laurel can correct that if I miss something.
Okay, when you say annual salary, you mean annual compensation, right? Because it could include at least some
salary benefits
of the benefits, right?
Yes.
Okay.
Yep.
Okay.
That's correct.
And that goes to you?
Yes. You can send it to Mariana. Her email's at the end of this. She'll get it to me.
Okay. All right. All right.
Okay. I'm going to keep going with the budget, but I'll get to the budget adjustment, how you can report some of these details to us. Line item 5 here is for travel and professional development. So we have built into both the DAs and the LEAs local mileage, meaning driving around Vermont to go to the different schools or districts or wherever meetings might happen. We're going to have some annual gatherings of the broad group. We also are really encouraging teams to send a team from your DCLT to the BEST Summer Institute in June. There's a link at the bottom of this. There's a strand that will be really targeted around the Project Aware folks with Amy Flamini. It's strand I. And so both the LEAs and the designated agencies have funds for a team. So for the LEAs up to 4 people, and for the DA, I think we put in for 1 person to send a team from your region to the Summer Institute, and we'll have some focus around Project Aware within that. So that'll cover the registration fee, the hotel, the per diem, and the local travel. And then in future years, again, encourage folks to continue to attend that Summer Institute. If there's a different conference, some of those funds can be used for other related to social, emotional, mental health topics. And that's it. So just sticking with the basic parts of the funding, our payment terms at the state are net 30, meaning once we have a complete invoice and report that's, in your payment provisions, that you're submitting data, you've submitted the programmatic side of what's expected, then we have up to 30 days to make payment on that accurate invoice. What we're looking for in your invoices, you need to make sure you're including your grant number, that you're marking the period of the invoice. So if you're doing quarterly invoicing, what is that period that you're covering? And that it's expensed by the budget line items that we have. We actually have a template that we can send out to you all to use, if that would be the simplest way to do this. And we can send that out along with the slides and everything after this. We do expect that people are retaining your financial records so that you have backup documentation should there be an audit. We have been audited in the past on some of our federal grants, so it's not unusual. And when the state gets audited, we then have to engage with those who we have funding flowing out to. I'll get to you in one sec. I'm just going to go through the rest of the slide. And then we have to do an annual federal financial report every year. And we have to draw down the federal funds. So on a quarterly basis, we're drawing down federal funds based on what we've paid out. But at the end of the year, at the end of the federal fiscal year, it's really important that we get all the invoices in on time so we can pay them out in time so that we can complete this annual financial report by the end of December. It's in that time frame that we also have more accurate information about what have we spent, what have we obligated but not spent, and so there might be some lingering invoices that are coming in. So we're going to be in conversation with you about, is this everything? Because if we have unspent, unobligated funds or obligated funds that are no longer obligated, we can then decide to carry forward anything that's unspent from our first year into our second year. And we're allowed from SAMHSA to do up to 25% carry forward on our own without seeking prior approval. If we have more than that, which often we do after the first year, we have to do a formal carry forward, which usually doesn't happen. We have to get through this federal reporting by the end of December, and then we submit a carry forward. We figure out what it is we want to spend the money on. So we'll come to you in January and say, do you have specific needs that you could use some additional funding for, which might be more programming related to mental health? It might be, I don't know, we want a temporary staff person to help us with this part of the project. We want to do a youth-led blah, blah, blah. So you would need to submit a proposal and a detailed budget that we would then compile together, and we have to submit to SAMHSA by a certain date in February. And then we usually don't hear from them until like March that, yes, you can spend the money. And if you hear those dates, that's like 6 months into the fiscal year that we then have the remaining time to spend those funds. So the formal carry forward process is a little more complicated and is usually for one-time type of activities that can be done in a shorter time period. It's not for, can we do a salary increase to this person for the next 4 years? We'll be more in touch with you about this, but I just wanted you to understand kind of why these timelines are important so that we can get the federal funding paid to the state to cover what we've paid out, but then also to know what do we have available to bring forward into the future years. Okay. Mark, I see your hand up.
Oh, sorry.
Is that lingering? Okay. Tracy.
I just wanted to remind folks, and correct me if I'm wrong, Laurel, but this grant is not in the grant management system.
Correct.
It's with Department of Mental Health. So just to be clear on that in case people didn't know.
Okay, this is a sample fake numbers invoice. So this is an invoice template that our department has created for all of the different type of federal grants that we have. Some grants require match. This one does not, but in case you see that on here, that's not relevant to our grant. But this is something that we can send out. It'll be blank as far as the program name and the vendor name and the dollar amounts, but you can fill in the rows that are relevant for the expenditures that you've had, and then submit this electronically. You can sign it electronically to the state, and along with whatever other documentation needs to be reported according to your payment provisions. And we will review this and then issue the payment on it. But I wanted you to see like what this might look like. And this is a way that you can then track what were your prior expenditures, what are your current period expenditures, and then what's the remaining balance. So that's the top part. This is the bottom part. There's a spot down in the bottom where you can electronically sign. And this is it's nice to kind of have some continuity of how these come in. If you have your own invoice template and it meets all of these requirements, that's also fine. We're just offering this as a tool. Any questions, especially from the finance folks on this? Yep, we will send it out. Ellie?
Just to be 100% clear, if we have a quarter like the quarter that's coming due in April where we haven't had any expenditures, do you require a report even if it will be blank?
No. I'm saying no. Actually, Mariana, do you want to write that down for Alex? I'm 99% sure the answer is no.
Thank you.
Yep. Okay, this is another special condition. I kind of mentioned it that SAMHSA had in our notice of award that we had to provide a budget, updated detailed budget and narrative justification. So we have it nearly ready to go. If you have any specifics to your universal screening tool or social emotional mental health and wellness programming, please send that in to us and we'll include it. Otherwise, we've spoken with we have both a kind of program project officer and then a grant management specialist who's more of the finance budget person. We spoke with our project officer to say we don't think we're going to have the detail yet and explained why. From a program side, it made a lot of sense to her. So I am prepared to say we're not ready to submit this detail yet. But like I said, if you do have it, we welcome it and we will include it. We'll see how the grant management specialist responds to our submission and hope that it's fine that we're continuing to postpone this one a little bit. But I wanted you to see kind of the language that they're asking us. So this is the same thing. Okay.
And Laurel, I just wanted to point out for folks that are on the phone in case they didn't see the chat. I know you responded to it, but we are going to send out these invoices with the slides, and that we'll send out the templates and all of that to folks.
Yep. If you want, we have like a budget update template that you can send in. So I'll attach that too. This is a way that you can share with us, like what are those details beneath those different things. You can add lines if you need more lines for the mental health programming. But this would help provide us some of the detail that we then have to give to the feds. Okay. So I already said this, we know that we're underspent already, all of us, including the state, in our budgets. You can make budget adjustments without our approval within those line items for up to 10%. If you want a new line item or if you wanted to do more than 10%, reach out to us and tell us what your plan is, and we will say, yep, that sounds reasonable, or can you give us a little more detail about X? If as you go, you're realizing, it would be great if we actually could have, is there another like 15,000 that we could use for this particular project? We do have some unspent funds at the state level that we might be able to reallocate out. I don't necessarily want it to be a first come, first serve So at some point, we might put a inquiry out to everyone and say, do you have needs? Let us know what it is. Doing a budget increase to any of you will mean an amendment to your current funding agreement. So that will take some time. We'll need the details of what it is so that we can put it into the work specifications, and then the budget breakdown would go into an updated budget table. But there is the possibility that we'll be able to do that. So I just wanted to make sure that folks understood that, but it needed a prior approval and discussion with the department for that. And then I talked in here briefly about the carry forward. So there often will be a time kind of as we enter November, December, where we're saying we've definitely got some carry forward. So start thinking about how you might want to reuse that in year 2. Just knowing that it is a short-term funding kind of thing. And that's likely to happen every year. There often is some unspent dollars, but we'll see. And that's it. So here are the points of contact. If you send it to Mariana, I can help weigh in as she fields your questions. And then Alex Vanafra is our financial manager. And she might be someone that's, I know she's been in touch with all of you already because she was helping get your agreements in place and asking for some of the other like insurance coverage and all that stuff that was required. So hopefully you've already had contact with her, but she can also help answer specific questions with the invoice or payment process or any of that. So what other questions do you have that we didn't address today? Stop sharing. Any other questions people have about process or specific details? Go ahead, Cassandra.
Thank you. Often we get this question when folks are registering or attending for the Summer Institute. And the question is, with this current funding structure, are there funds available to pay stipends for staff to attend the Summer Institute in addition to the registration fee?
Great question. We don't have that as a budget line item. If you have unspent funds and that's something that kind of is aligned with your policy and how you compensate staff, reach out to us, send us your proposal of what you would do, and we can talk about that. We don't have that built into the budget for every year. So it's a question of what are you setting up for kind of precedents, and will there be funds to be able to cover that in future years? Maybe, but no guarantee.
Thank you.
Yeah. It's a great question though. What other questions?
I had also just quickly stuck in the chat in case folks didn't see it, my sort of plug for working with Amy Flamini, who is out of Chicago and is really great, has been doing this work, bringing together the DAs and the LEAs and helping them work together to think about expanding school mental health. So it's a pretty awesome opportunity. And it's great. It's a great time at the end of the year when things have calmed down to get folks together and just have a lot of intentional conversation.
Thanks, Mariana. To Renee and to other finance folks, when we send the invoice template, if when you're reviewing it, you're like, well, this doesn't quite work, or what about this, or there's something broken in it because it's a Excel template, please just reach out to us. We can make adjustments or fix if there's a formula or cell that's not working or something like that. Don't hesitate at all. We're glad to talk through that. Noreen, from a DA perspective, any questions this brings up?
I was just thinking about summer a little bit and what's going to happen, if anything.
it just sounds like, you know, I mean, I just think we've got to get somebody hired, obviously.
Mhm.
And I'm really glad to hear that Mark's going to be making an offer soon. So that's great. And also kind of wondering about the Best Institute. If I don't have somebody hired, if I should go, if I should send somebody else to go, you know, that kind of thing.
Yeah.
Some of that.
Yeah, I think if you don't have a mental health coordinator hired yet, I think it'd be great for you to go, Noreen, if that's something that you can make your time for. Because I think then you'll be able to support that person who will be coming in at some point.
Right. That's what I was thinking.
Yeah.
Yeah, I think
Des has a doodle poll that we just completed. So hopefully we'll get a meeting together with, you know, the DA and CCSU, and we can make this happen.
Just found a date. Look in your email, Noreen. It should be coming.
Awesome.
It's hurting cats a little bit with all these folks.
Yes.
And Noreen, I'm thinking potentially the same thing depending on the person that we hire. If that person accepts, it might be a tall order to ask them to attend. It's somewhat late notice, so I believe I will have time in my schedule to go and would be willing to do that.
Right.
It's also a great team building, you know,
Yeah.
week.
And it's the Killington Grand. It's lovely.
Yeah. Yeah. It's always a draw. Go ahead, Ellie.
So I was just kind of processing in my head the idea of the carry forward funds from year to year. And for CCSU, we do have year one starting January of 2024. And it seems like, you know, for several months anyway, we won't be expending out any money because we have yet to hire somebody.
Right.
And so once this person does become hired, we had a concern of would $80,000 be enough to cover a full FTE position? And if it were not, then how were we going to, you know, complete that comp and ben package? But with potential carry forward funds that are unspent as of this fiscal year that we're not using, maybe that could help complete the circle. Am I thinking of that correctly? That maybe we don't need to necessarily find a second source?
Well, it's one of those things where with the carry forward, that's the formal term for the award to the state from SAMHSA. So that's about DMH and SAMHSA. So we at DMH have to submit a request to SAMHSA to carry our whole grant funds, whatever we have unspent, forward, and we have to submit a proposal for it, and that allows us to use it in the next fiscal year. But we won't know we have that approved if it's more than that 25% until March. And so what concerns me is that time frame from October to March. If it's committed into the longer term thing like a salary versus a short term thing that you can do in April or May or, you know, whenever. It's one of those things where I will say sometimes if we really see that we have a huge amount of funds, like half of our awards that we're going to be asking to carry forward, we might be, well, let me say how we can play this out sometimes. So if we're carrying forward a large amount into year two, we might not even spend all of that in year two. And then we're looking at a carry forward to year three. And so sometimes you end up doing that from year to year to year, which can be beneficial. And then there are sometimes where other unexpected costs come up, and so we're having to cover it through that. If you have a way that you can cover in anticipation that we're going to get it, but we don't know yet, and then if we don't get it approved, you've got it covered, great. I think it is, it's harder to commit to that type of salary increase for 5 years. So it's taking a chance. I will say we do not have budgeted, we don't have any room in our budget for years 2, 3, 4, and 5 to move stuff around right now. But that was based on what we were projecting last year. So again, it's possible there might be room to adjust things. So given all of those caveats and potentials, I would say stay in communication with us and let's see what we can talk through.
Okay, yeah, thanks for talking that through with me. It sounds like we'll still go with our original plan of trying to find a second source to pay for it, but maybe we can be optimistic and hope that Project Aware can
be the primary.
Make that position whole once the time is right.
Yeah.
Awesome.
How that comes into play with supplant. I mean, obviously this is a new position. You're not supplanting something that existed before. You're just trying to figure out how do we fund to get what we need. Yeah. This is not your only time to ask questions related to budget and invoicing and all that. We just wanted to have a time focused on it because we knew questions were coming up, but feel free to reach out at any point as they arise. But we still have a little time if there are questions on this, or if there are other project related questions that have nothing to do with budget, you've got people here. We're glad to answer or talk about any of those other things, including what other topics do you want to make sure we're covering in these office hours? I think we're doing a session on evaluation and data collection. Marianne, I'm kind of looking to you. But if there are other pointed topics that you want to make sure we cover, we welcome input on that as well.
Yeah, we did just do evaluation.
Oh, that was last week when I wasn't here.
A bit last week, but it was, is a more general understanding of it, and they're still developing their protocols for how they're going to collect all of that data. So I imagine as that gets further developed and fleshed out, they'll want to come and talk about it some more to really help folks understand and walk them through. But I also think they're planning to meet with teams individually and walk them through it as well.
Great. What else is coming up for folks?
One of the topics we sort of batted around was thinking about how to best use your DA in this project and what the DA's role is, because it is such a school focused piece at times that we want to make sure that our that there's sort of equal sitting at these tables, and that we're really focused on our mental health experts helping us develop this work. So that was an idea we batted around for an office hour topic. I don't know if folks think that might be helpful, or if there's other topics you can think of.
I saw some heads nodding, and I think that's a good one because we intentionally put this in as a consultant coordinator role, not a direct service seeing individual students type of role, really wanting to get at that more systemic lens across the district and schools. And that is a different way of working together, I think. And I think our partners at UVM and Amy Flamini are definitely good resources to help figure out how that can work, what that role can look like. Okay.
I guess I'll throw something out. I just wonder about like the previous recipients from the previous grant. Are there any folks that might want to kind of come on and share some of their pearls of wisdom with us and what they've learned and how we could maybe benefit from what they learned? It's a thought.
Yeah, we've kind of given a heads up to the Lamoille region about be tapping you all for some of that because they definitely did quite a bit in their partnership together. OSSU and Lamoille County Mental Health.
Yeah, that's a great idea, Noreen. I think they would be glad to come and talk about it. And it is a little bit of a different grant this time around, but there's partly because we learned so much that first time. So it would be great to talk about that. Cassandra, can I ask you and your folks if when the registration closes for BEST, and I know you had sent me an email saying if folks sort of had an idea of how many they might send, we could get a ballpark figure that way without having to like go through and formally commit quite yet if folks are still thinking about it.
Yeah, no, that would be great. There's not really a registration deadline, but it does fill up relatively soon. So hopefully by, I would say, if you're thinking about it, if you could just let us know, we can always make sure we're holding some spots for your teams. We just really want to make sure there's an opportunity for all of you to join us, which sounds wonderful. So just let us know. I think in the next few weeks, by the end of April, if you could just give us a heads up even earlier would be wonderful. Again, wanting to make sure we have spots for all of you.
Thanks. And again, if you're signing up or if you hear that your schools are signing up individually, then it might be wise to sort of steer them toward that strand I because of the work that we're doing. I really think it'll be incredibly valuable for folks to be there and doing that. And also just if folks are already sort of invested in this, in the BEST work, then we can sort of be hitting two birds there.
All right. Well, thanks all for joining. We will get out the recordings and the different workbooks, invoice templates, all of that out to you, and we'll be in touch. We'll see you next week. Thank you.
Bye, Al.
Mariana, Laurel, or Mariana. I just sent a chat in the our planning meeting that the meeting that got scheduled that Des and Noreen were speaking of overlaps with our monitoring check-in with SAMHSA. So maybe you and I could attend the division meeting, the district meeting, and Laurel the other, or I don't know if there's any flexibility in rescheduling with SAMHSA, but it's on the 18th, the morning of the 18th.
Thank you for noticing that. Okay. Yeah, I think that probably we can split up and make that happen. Okay. I do think that you and I should be prioritize that local meeting for sure.
Okay, good. Just wanted to mention it because it's, since the meeting's a Zoom link, it's not showing up in our calendars in the same way that it would if it were scheduled through Teams. Right.
Thank you.
Okay.
Way to put the dots together. I still see Ellie and Lindsay, and I just want to make sure that they're either like not able to close out of the meeting or just aren't waiting for us to answer some more individual questions. Do you see them on your end too, Tracy? You're muted.
Yes, Lindsay's screen is frozen and Ellie's off camera. I'm not seeing anything in chat, so I think.
Okay, we're probably good then.
And we may have recorded more than we needed to, so I don't know if there's a way to cut the end off or not.
Yeah, I'll try to figure it out. Do you know where the recordings live once we end recording?
It shows up here. Let me turn it off.